There are three main treatments for major depression, and they are often used together to achieve the best results. The treatments most commonly used are medication therapies, therapy or counseling, and brain stimulation techniques. Since major depression is episodic, some people will benefit from short-term treatments only when necessary. But in more severe cases, ongoing treatment may be required. So first, let's talk about medication treatments. Drug therapies for depression help balance the internal chemistry of the brain. They typically take time to have full effect, which can take 2 to 6 weeks. If you're not seeing an improvement over the course of several weeks, your doctor may switch medications, so you'll need to have some patience as you work together during this time. Like all medications, there may be side effects, so ask your doctor about those. Usually, the first type of medication used is an antidepressant. These drugs are thought to work by regulating one or more of the brain chemicals, serotonin, dopamine, and norepinephrine. The main types of antidepressants are SSRIs, or selective serotonin reuptake inhibitors. These work by increasing the amount of serotonin in the brain. Side effects can include sexual dysfunction, nausea, and anxiety. SNRIs, or serotonin norepinephrine reuptake inhibitors, also work by boosting the level of serotonin and norepinephrine in the brain. The side effects are similar to SSRIs, but they typically cause fewer sexual side effects. MAOIs, or monoamine oxidase inhibitors, are used in some people who have chronic depression. These are prescribed much less often because of their side effects, including serious interactions with other medications and some foods. Tricyclic antidepressants are an older class of drugs, but have been shown to be effective in treating severe depression. Side effects include heart problems, sexual dysfunction, tremors, and a decreased threshold for seizures. Bupropion may be prescribed for major depression as it increases the amount of norepinephrine in the brain. It's particularly helpful in patients who experience weight gain and sexual dysfunction as side effects while on other medications. Mirtazapine is an antidepressant that enhances both the release of serotonin and norepinephrine, but it also has sedating qualities, and so it is often used in people who suffer from insomnia and anxiety along with their depression. While it isn't an antidepressant, the herb St. John's wort may be recommended for people with mild cases of depression. This is typically taken as a supplement, which isn't regulated by the Food and Drug Administration. So, talk to your doctor about specific forms it comes in and the amount that may be right for you. While many people with depression will see improvement with the antidepressants, some people don't get a full lift out of their depression. In these instances, doctors may prescribe add-on therapies. These include atypical antipsychotic medications. These medications were developed to help people with other forms of depression, but studies have shown they work well in relieving symptoms of major depression when used along with an antidepressant medication. Mood stabilizers, like lithium, can help treat major depression, but there's not as much evidence of success as compared to antidepressant medications. And anxiolytics are prescribed for people with depression and anxiety.